Good morning, beautiful people. Thanks for tuning in to my YouTube channel today. Please don't forget to click the like and the subscribe button below. Anyway, for today's video, I will be talking to you about what are those medical cases that I usually encounter here at work. Here in America, since primary care clinic is very common, so it's important to know what do we deal with in the primary care clinic. Okay? So, enjoy! Ano nangyari? Nawala yung video. Ewan ko kung na-copy yun. Okay. So, one of the medical cases that I encounter is hypertension. So, if somebody has hypertension or diagnosed with hypertension, what is my responsibility as a primary care nurse? So, my first responsibility is to make sure that they are on track with their medications. Okay? So that's my responsibility. They are on track because sometimes, of course, some people are not they're not aware on what specific medication they're taking or the dosing or the timing. So it's very important that you educate them. Okay, so as a primary care nurse, my role is to make sure that they're checking their blood pressure at home. Usually we recommend at least once a day before taking medications in the morning. And then make sure they have their blood pressure logs, they write it down. And usually 2 weeks time, like 2 weeks time of checking blood pressure, they will have to come back and relay to us what are their blood pressure readings at home. And in that way, we will know if the medication that they started, if it worked well for them, or do you think we need to change or add another medication? Usually within 2 weeks to 1 month time, making sure that they're taking it. And also health teaching. How do you do health teaching? So when they come in, of course it's considered as a patient visit. It will be scheduled in my schedule. And then let's say they come in and they're bringing this blood pressure logs, and you tell them, oh, your blood pressure logs it's been like up and down, changes. Of course you have to ask them what are the factors that could contribute to those high blood pressure readings. Okay, and also ask them if they've been taking medications, or are they do they have symptoms during that time when the blood pressure was high. You ask them, and then you take down notes, and then educate them that blood pressure changes like every second, every minute, and factors that will change it varies as well. So kayo mga nursing student, make sure you learn what are the factors of hypertension, factors causing hypertension. Kasi hindi lang naman hypertension yung diseases siguro. Baka meron ding diabetes, baka may kidney problem, or maybe there's high cholesterol level. So there's a lot of factors why hypertension is prevalent, or maybe why there is a hypertension. And aside from that, you as a primary care nurse, kung alam ko na yung hypertension or blood pressure readings ng pasyente, kung alam ko na yun, sasabihin ko yun sa doktor. So let's say Dr. so and so, sabihin ko, ito yung ano niya, doc, ito yung blood pressure niya for the past 2 weeks. Anong gagawin natin, doc? What will be our intervention? Do you think we need to adjust the medication? Do you think we need to just maintain the medication and just continue to monitor? So something like that. You have to relay those information to your providers, to their providers. And basically, as a primary care nurse, you are also acting like an advocate, a patient advocate. Kasi that's just the way it is. You have to be the nabubulol na ako. You have to be acting in behalf of the patient. Okay? Kasi kailangan nila ng help, kasi some of them, they don't have knowledge with all these medications, hindi nila maintindihan. So you have to educate them and assure them that you're willing to help. So that's one of the cases that I handle. And then kung pupunta sila dito, hypertension visit, you can also offer vaccines. So, for example, due sila ng flu shot. So, you offer flu shot vaccine. Do you want it? Or COVID booster? Or pneumonia shot. Mga ganon. So, you will, chika-chika them and tell them if they want these vaccines. Okay? And then, tell them, kung merong mga due sa notes. Minsan kasi mag-a-appear yan kung yung pasyente, due ng foot exam, due ng blood pressure logs, due ng retinopathy. So, mga ganon, magre-recommend ka lang, magre-reinforce ka lang sa kanila. Syempre, they have the right to refuse. If they don't want to do those things, you don't have to insist. You just have to educate them and give them assurance that if they're willing to do those other things, then you are there to help them. Okay? Hi people. So, I'm going home now. I'm just getting out from the clinic. Anyway, so I'm gonna show you how dark it is right now. Okay? Look at this. This is so dark. It's only 5 o'clock. Anyway, you can't even see me. Yeah, right? It's dark. The other medical case that I usually encounter is the medication-assisted treatment. So there are varieties, there are different medication-assisted treatment. So one of it is the opioid use medication treatment. So for those who are interested in getting off use of opioids, so nurses or nursing student, ano yung mga opioids? Fentanyl, heroin, oxycodone, Percocet, yung mga ganon. So, if ang isang tao dependent doon, syempre nakaka-overuse yun, di ba? You can be overusing it and baka mag-overdose. So, to prevent that from happening, these people are like voluntarily wanting themselves to get off of it and they need help. So they see a provider and the provider gives them the details of the program and the nurses assist with the visit. So for example, if a patient sees a doctor right now, so after 2 weeks, they will see a nurse and kami, yung nagmamonitor sa kanila, we ask them questions and we have a template that we follow in our computer system. We have a template, we ask them questions. We do a lot of assessment, usually mental assessment. We ask them questions pertaining on how they use the medications and if there are factors that affects their usage of it, and if there are factors that hinders them, if what else do they need, if they have cravings for opioids, how do they overcome it. We ask questions like what are their if they have support. It's very important to ask those questions kasi doon mo makikita kung ano na siya, kung talagang yung pasyente nag-struggle ba or yung patient okay na ba siya. So usually may mga nagtatagal ng 1 year sa program or 2 years or minsan months, depende. So kailangan natin as a nurse to be an advocate to our patients. Isa sa way is to communicate to the providers kung ano yung mga sinabi ng pasyente sa amin. Of course, I cannot, share it dito. It's very, it's a Hippa violation kung mag-share ako. Anyway, yun. So, if mag-share sila ng struggles nila, of course, we have to be very observant also kasi we have to assess the way they answer questions and the way if they're consistent with their answers. So, as a primary care nurse, I have to educate them of the importance of using the medication properly. So, yung medication na yun, you can research it. We call it Suboxone, Sublocade, buprenorphine, those kind of medications. So, nurses, Nursing students, research those. It could be part of your board exam. It could be part of the NCLEX. Yes, I only learned these medications when I came here in America. And it's so cool. It's so cool to learn this additional knowledge. And it's also helpful mentally because I'm able to know kung ano yung kaya kong gawin. We have to separate our emotional issues and emotional baggage. So, yeah. So, anyway, yun. Ano pa ba? Mag-share pa ako all the way. So, yun. So, yun yung visit. That's the visit about opioid use. And may pipirman sila na contract. So, the nurse should be discussing with them point by point, line by line about the contract, reinforcing to them, health teaching, and giving them assurance that you are there with them. You are there to help them. Okay? Tapos, pag mag-relapse sila, usually relapse is very common. Pag mag-relapse sila, it's okay na don't judge them na nag-relapse sila. Help them. Assure them. Assurance. So, mga nursing student, yun yun. So, your self-awareness, dapat talaga, while nag-student pa kayo, you will know all those therapeutic communication. You will know how to apply the therapeutic communication and not non-judgmental questions. Learn those. Therapeutic communication and non-judgmental questions. Learn those. It's in the psychiatric nursing book. See? Hindi ko alam kung nasan yung libro ko. Basta, nandun yun.